did hear that there was a suspicious death at the university teaching hospital. That is one of the questions that has continued to be asked. This morning, the Permanent Secretary, Kennedy Malama, was on a radio station just explaining the measures that are being put in place to ensure that COVID-19 does not spread. And this is why these press briefings are very important. Right now, I'll hand you over to the Minister of Health, Dr. Chitali Chilugea, just to give us an update. This is the 20th update we're getting on the COVID-19.
Good afternoon, countrymen and women. Good afternoon, members of the press. Today, I am joined during this press briefing by the heroes in our technical team. We have the Director General for the Zambia National Public Health Institute, who is the commander of the Incident Management System, Professor Mukonka. Welcome.
Thank you.
Yeah, we also have the National Director who looks at infectious diseases and looks at ART services in the country and is leading the case management cluster, Professor Lloyd Mulenga. Welcome. And also have the two permanent secretaries from the Ministry of Health, Dr. Kenneth Malama and Madam Kakurvela Mlalelo. We do recognize in the audience a leader of one of the major religious groupings in the country, the President, Reverend Kombwa. Welcome from the Seventh-day Adventist. We recognize you. We further recognize authorities in the public health, Professor Babu, and senior consultants from the University Teaching Hospital, also directors in the Ministry of Health, Dr. Makupe, and your team. Distinguished ladies and gentlemen, yesterday we were privileged to be addressed by His Excellency the President of the Republic of Zambia, Dr. Edgar Chagolungu, where he gave very clear directives on the way forward in the fight against COVID-19. The President did give clear guidance on his expectations in the 2 weeks that ensued the expiration of the initial 2-week period. The President did extend the measures, the implementation period for the measures he had announced earlier on for another 2 weeks. And to recap, the President made it very clear. The President made it very clear that there was an opportunity to sustain the gains that had been attained to date and preserve the country's health security by scaling up interventions that had proven to be effective, such as the ones that he had ordered, introduced or implemented in the country. The President made it very clear that from the successes scored in the last 2 weeks, he now had the confidence that through an extension of another 2 weeks, the pandemic would actually evolve in our favor. He emphasized the following personal and social behavioral conducts that should be adhered to by all Zambians, and I would like to emphasize that the President emphasized that citizens were to ensure that they wear masks. Today, I'm putting on a mask that was homemade by Lusaka Health, an NGO based in Lusaka, and they've been making these masks and giving to communities. It's a cloth mask, and it is important that we wear these masks in all public places such as markets, buses, bus stops and shopping malls. This creates the barrier between you and the next person who is infected, between you who may be infected and the next person who may not be infected. So this mask is a critical personal protective piece of equipment and must be worn at all times. Let it be our culture in this period. The President did emphasize that all citizens need to practice high levels of hygiene at personal level and at the collective level in the environment. Hand washing with water and soap or using alcohol-based sanitizers. That is critical for us to remove the microbes from our hands. Furthermore, the President emphasized that there was need to be acting in solidarity with your neighbor if you had a cough or a sneeze or a flu, or you were talking and splashing out droplets, by ensuring that you use a flexed elbow when coughing, for instance. The citizens were all reminded that we needed to dispose of any tissue or materials we're using, as we're coughing in a bin. We were advised further, admonished further to avoid fidgeting with our mouth and our nose because we risked introducing micro droplets that contain the COVID particle in our mouth, in our respiratory system rather. Furthermore, social distancing was emphasized, and that we needed to ensure a minimum of a meter difference so that as anybody did introduce anything in the environment, we did not inhale in our respiratory system any COVID containing droplets or particles. The President emphasized the need to stay home. If you are not an essential worker and you don't need to be, please stay home. The President emphasized that. Cleaning and disinfecting our places did come out very, very strongly. I want to emphasize today that we will continue updating the nation on the current situation of the COVID-19 epidemic or pandemic. And today I am privileged to update the nation on the latest as a build-up to what the President announced to the nation yesterday. The President said to the nation yesterday that we were investigating a suspicious death at the University Teaching Hospital, and I will be beginning with that. The President alluded to the fact that the University Teaching Hospital had received a patient who died in suspicious circumstances, and they had launched investigations, and today I provide details of the investigation. This investigation involved a 50-year-old hypertensive man with a chronic cardiac condition who comes from Kafue, who was referred to the University Teaching Hospital in an unconscious state on Sunday, the 5th of April, and UTH received the patient and did resuscitate and intubate the patient in the casualty department, and immediately referred the patient to the intensive care management unit where he was hooked onto a ventilator. This patient remained on the vent until the early hours of the third day when he passed on. This patient, because of the high index of suspicion, was being managed from an isolation unit, a side ward in the intensive care unit, and samples were taken for various investigations, what we call a sepsis screen, including screening for COVID-19. And the day that he passed on, we did get the result that COVID-19 indeed was positive in this patient. So therefore, Zambia records the second COVID-19 death in the patient that passed on in the isolation unit of the intensive care ward. May his soul rest in peace, and could we observe a moment of silence in honor of the late patient. May he so rest in peace. On behalf of the government, His Excellency, the President of the Republic of Zambia, Dr. Edgar Chapolungu, we convey condolences to the bereaved family. We have mounted investigations. We have started conducting a robust contact tracing program, and we have contacted all the close contacts. He was staying alone, and we have contacted anybody who could have come into close contact in the due course of his illness and in the last few days of his life. So these contacts have been swabbed, and their samples are being investigated, and we will get the results by tomorrow. We have provided a very high-level team, very high-level multidisciplinary team, and dispatched it to the area to ensure that we do robust contact tracing in the area. Furthermore, the intensive care unit has been fumigated, and all the staff that came into contact with the patient quarantined and equally swabbed and are being investigated. There should be no cause for alarm, and we are going to keep the nation informed on the result of this robust investigation. We did confirm by autopsy that this patient indeed died from COVID, from the samples that we took. Distinguished ladies and gentlemen, getting back to the other statistics, in the last 24 hours we conducted 22 tests, and we did not record any new positive from those 22 tests, and therefore we have remained at the cumulative number of 40, having admitted one more person to the statistics, and we have moved our death toll to 2, and we have discharged one more patient in the last 24 hours, and therefore that brings our cumulative discharges to 25. This therefore means that our patients in admission now remain at 13, and all these patients remain stable except for one who intermittently requires oxygen by nasal catheter, and otherwise is not deteriorating rather. The 2 patients that remain on the copper belt remain stable, and the 11 that are in our various isolation facilities in Lusaka are equally stable. The 10 patients apart from the one I did refer to earlier. Distinguished ladies and gentlemen, from the people that we have been following up who put under self-quarantine or in mandatory quarantine, 1,890 have successfully completed the 14-day quarantine period and have been discharged off this quarantine period and reintegrated into society. We remain committed to following up alerts and contacts of confirmed cases. Looking at the global picture, a cumulative total of 1,605,345 cases have been recorded, with a death toll of 95,752. This is happening in 209 countries and international cruise liners. A total of 356,952 individuals have recovered from the infection so far. Back home in Africa, we have recorded 12,915 cases with 634 deaths in 54 countries. Distinguished ladies and gentlemen, Zambia being privileged to anchor the Regional Collaborating Center for the Africa Center for Disease Control for SADC. We do report on the pandemic in the SADC region, And amongst our 10 member states in SADC, we have recorded 2,069 cases, including 26 deaths, and so far 132 recoveries have been reported. Distinguished ladies and gentlemen, the call today is to follow judiciously the guidance that His Excellency President Lungu gave yesterday. Stay home, no unessential movements, wear a mask as you go to markets, as you get on buses. Wash your hands with soap and water or use an alcohol-based sanitizer. Keep the environment clean and ensure there's no room for micro droplets with COVID-19 virus in it. Let us ensure that we maintain social distancing and let us avoid mass gatherings. It is important to follow the guidance that the President has given, because if we are exhibiting unity of purpose and collective discipline as a nation, we will be able to overcome COVID-19. Human-to-human transmission can be disrupted by strictly adhering to the measures as announced by His Excellency, President Dr. Edgar Chagwa Lungu. Distinguished ladies and gentlemen, I further make a call to individuals who are abrogating the quarantine rules that they shall face the wrath of the law, because by abrogating these rules, they are exposing to risk the bigger population. The Public Health Act, Cap 295, SI 22 of 2020 is clear on individuals that are threatening public security. Those who are coming back into Zambia, as the head of state did emphasize, will be welcome back or will be welcome into Zambia, but they shall be subjected to a mandatory 14-day quarantine in designated places. And for those who are managing, who are essential workers bringing in essential services, we want to assure you that we will be expedient in screening and testing and ensure that trade flows freely. At this point in time, let me send a message from His Excellency President Edgar Chagwa Lungu to all the members of the corporate world who have been supportive of Zambia's fight against COVID-19. We have been receiving logistics through Ethiopian Airlines. We'd like to thank Ethiopian Airlines that have continued to fly into Zambia, bringing logistics that have helped us combat COVID-19. We'd like to further thank all the corporates that have participated in mobilizing logistics and resources for the fight against COVID-19. We thank the US CDC, we thank the Japanese government, the Chinese government, the EU, the World Bank, the UN system, the Asian, the African, Indian community in Zambia, Lamasat, the banks that have come on board, such as Zanaco, Stanbic, that have come on board to ensure that we work together with government to support this cause. Many others that have come on board from the business world that we have not mentioned, many other charitable organizations such as Osaka Health that have come on board. We thank you profusely. LICO that has contributed to the welfare of our health workers, we thank you most sincerely and urge you on. The route that we have used to bring in goods through Ethiopian Airlines, I reiterate President Lungu's appreciation for your continued goodwill. The various international travelers that have been cooperative to the quarantine program, we place on record our gratitude. We have received foreign drivers who bring in essential goods and have quarantined them at the University of Zambia. We, out of 195, have discharged 147 to carry on their trips, to their various destinations, and others to reintegrate in our community. We'll continue to coordinate all players, as provided for in the multi-sectoral response that this government has embarked on, to ensure that we strike that delicate balance between ensuring the economy is running and averting a health catastrophe. Let me conclude by emphasizing the need for us to work together to ensure that we stop human-to-human transmission of COVID-19. And together, we can support President Lungu's agenda for a healthy nation through public health security impact. I thank you most sincerely.
Thank you so much, Honorable Minister, for that update on the current situation concerning the COVID-19 here in Zambia. We'll invite questions from the journalists who are here. We'll take 3 at a time. Please, as you ask the Minister for clarification, give us your full name, the organization you're coming from, and then proceed with the question. Questions? Okay, I can see a hand there.
You said that contacts to the deceased or close contacts are being traced. I'd just like to know how many of those contacts have been traced. Then the second question is a follow-up on the medical personnel, the doctors and paramedics who are supposed to be employed. What is the status so far? Last one, how many tests are we able to conduct as a country in a day? Thank you.
Yeah. Any other questions? Yes, sir. Come through and
Good afternoon. This is Jeff Eskar from KBNTV. Honorable Minister, I want to find out from the patients who died from UTH Hospital, is it possible to estimate the period of time when the person contracted the virus? Then did he have some sort of symptoms that were shown when he was taken to hospital? Thank you.
thank you so much. Do you have any other? Okay, was there thanking Honorable Minister? Those were the 5 questions that have been posed.
Well, thank you very much. For the patient that died at the University Teaching Hospital, remember the history refers to a 58-year-old man who was living alone and who had an underlying heart condition and also hypertension. And he had been attending outpatient at the various hospitals, including Kafue General Hospital. At the time that he did come to the University Teaching Hospital, he was unconscious, and the team reacted very quickly by instituting resuscitation measures and intubating him and quickly taking him into the intensive care unit where they hooked him up onto a vent. So the patient came in already in a severe ill state, and the patient was unconscious. However, during his visits to the outpatient departments, yes, objective history is talking about him having complained about symptoms that relate to the general problems, to the general conditions, common conditions we have of malaria, and to what he was suffering from chronically. So, however, the University Teaching Hospital staff only received this patient as a referral already in the comatose state, and they did all they could to keep the patient well, and the index of suspicion was high enough so that they managed him from an isolation ward and also did the sepsis screen that included COVID-19. Objective history, again, does not bring out very strong epidemiological linkages with people who could have had this virus. However, the investigation is ongoing, and as we establish the contacts, we're getting more information. What is critical at the moment is to ensure that anybody who came into contact with him is traced, and tested so that should they be found positive, they are quickly isolated and managed. Remember that the bedrock to this response, the bedrock of this response involves prevention of new cases, early detection and isolation of positive cases. So this requires a very robust contact tracing mechanism followed by quarantine and the management of all positive cases. So this is what we are doing in this particular case, and we've established a tree to show his contacts, citing or anchoring mainly on people that knew him. And remember that this is an individual who stayed home alone. The issue of the medical doctors and other paramedics who we are supposed to employ, this has advanced significantly, and we expect this process to be concluded by Wednesday this coming week. And we will be deploying all this staff to strengthen port health services, surveillance, case management, to strengthen diagnostics and infection prevention, and also to ensure we enforce quarantine rules and risk communication. Furthermore, others will be, as they are working, also involved in research. Was there another question?
Honourable Minister, the number of tests that you're able to do? I think that's the last one.
We are able to conduct the number of tests that are necessary to be conducted depending on the contacts that we've established and the alerts that we've gotten. So the number of tests that we do relate to the alerts and to the contacts that relate to the positives, and that's how come you see fluctuation from 160 to 22, to 100, to 99, to 82, because we have a very aggressive surveillance team. However, I must take this opportunity to announce that we have raised the index of suspicion to ensure that we move not only from hospital surveillance, where we mandatorily swab those who come in with symptoms of a headache, fever, flu, chest pains, respiratory difficulties, to community-based surveillance, where before people become clinically ill, we're able to pick them up early. So we will be strengthening our diagnostics by moving from just investigating the contacts in the community of those who we know are positive, but also just establishing a mechanism where everyone who develops a symptom, even without epidemiological linkages, is tested in the community there. So that is, expanding or strengthening our surveillance testing that we are looking at. And we are able to do the tests that we require to do.
Thank you very much. Good afternoon, Minister. My first question is it not possible to name the patient who has died, ethics notwithstanding, since we already know his whereabouts? Naming him may help other contacts actually come up and get tested. The second question is, aren't you concerned with the public gatherings that we have continued to see, especially that we did see protests in Kitwe and Muflira? People are still gathering in large numbers and malls are still opening. So isn't this a source of concern for the ministry? Thank you.
Thank you so much. Do we have any other questions or questions before we call upon the Minister to respond? Honourable Ministers.
Well, thank you very much indeed. We will uphold the ethics of the trade, medicine, and we will not expose details beyond what we're able to, and therefore we will preserve the confidentiality and, that the patient deserved in life and in death, and also preserve the rights of the family that is bereaved. So we will not mention the name. Furthermore, in his guidance to the nation, the President has been consistent about the need to disrupt human-to-human transmission by avoiding mass gatherings. Mass gatherings, the church did appreciate the church for responding to his call not to gather by encouraging their membership to worship from home, by encouraging people who are supposed to have functions to gather in smaller numbers and with clearance from the Zambia National Public Health Institute that will look at the application through the lens of the Public Health Act and the statutory instruments that have been issued. So there is no debate. The President has been unequivocal about his position on mass gatherings. Don't gather in public gatherings, as this enhances transmission from human to human. And let us ensure social distancing should we be in places where there are people, and let us ensure we wear masks.
Thank you so much, Honorable Minister, for those responses. Do we have any other? Okay, seeing none, Honorable Minister, we have been joined by well wishers who are wishing to actually contribute towards the fight against COVID. So, with the permission, sir, I would want to see if I could call them forward here so they could do a presentation, and then we can review the response to that. So, we have in our midst the President of the Southern African Union of Seventh-day Adventists, Reverend Harrington Akomba. So, Reverend, please come over and just make the announcement.
Honorable Minister, all protocols observed, ladies and gentlemen, I stand here this afternoon representing the two officers of the Seventh-day Adventist Church in the Republic of Zambia. As some of you may know, because of increase in membership, at the point when we went beyond 1 million, we were divided into two national offices. So there is the Northern Zambia Union Conference with headquarters in Kitwe. I am from the Southern Zambia Union Conference office, headquarters here in Lusaka, and I serve as president here. I represent my colleague and counterpart, Pastor Sinyangwe, who is in the north. They are not part of what we are giving today for the simple reason that they were contacted by the Copperbelt Provincial Office to assist that side. So as I stand here, they are at a function somewhere in Kitwe. They were requested to assist in providing supplies for Kitwe and Kaflafuta. So they are presenting today staff worth 100,000 kwacha, and already, as some may have caught from the news, there was 30,000 that was given to the health office in Kabwe last week. So today, as I stand here, I hold in my hands, Honorable Minister, documents from the bank certifying a transfer from our office, the Southern Zambia Union Conference, of 160,000 kwacha cash that we are contributing in appreciation of your efforts as minister, in appreciation of the leadership of our President, Dr. Edgar Chagwalungu, in the fight against the spread of this pandemic. And so it is my honor now to present to you the document that certifies the actual transfer. The money is actually already in your account, Honorable Minister. Thank you. Thank you so much.
Thank you so much. That was Dr. Akomba Harrington, the South Zambia Union of the Seventh-day Adventists. Amazon here.
Good afternoon, distinguished ladies and gentlemen. My name is Bright Kapanamsawa, representing Amazon Shipping LLC. Today, the #1 shipping company from America to Zambia and Zambia. Firstly, before I announce our donation today, I'd like to thank the government of His Excellency Dr. Edgar Chagolungu, Health Minister Honorable Starishirike, and all the health personnel for the gallant efforts in fighting COVID-19. Today, I'm making a donation of 395 respiratory masks to contribute to the fight, to contribute to the safety of our friends and staff. God bless you all for this valuable service to humanity. I thank you.
Thank you so much, Amazon, for that kind donation. May I call upon the Environmental and Public Health Union of Zambia? You may be aware, Honorable Minister, majority of our people that are doing sensitization and public awareness, follow-ups of clients belong to the city. They've joined into actually add their works to the fight.
Good afternoon, Honorable Minister, and everyone, all protocols observed. This afternoon, I'm representing my colleagues from the Environmental Health and Public Health Union of Zambia. My name is Asali Tembo, I'm the General Secretary. This morning, we joined other stakeholders in supplementing government efforts in the fight against COVID-19, and we're making a donation of 10 hand-wash facilities from the union, and we'd like to thank the government for the support that they've given to us, even as environmental and public health workers, who are very key and one of the first frontline workers in this fight against COVID-19. As you may be aware, environmental health officers are the key health personnel in port health, as well as disease surveillance, infection prevention and control. So this morning we thought of joining hands with the government in bringing this donation and also supplementing efforts. Thank you very much.
Thank you so much, the Environmental and Public Health Union of Zambia. May I take this opportunity? You know, we've got a wide variety of people that are coming on board. And we have the Kalandania. Politicians have said we are not going to be left behind in terms of supporting the fight. And we have Mr. Makitu. And music production.
Good afternoon, Honorable Minister, ladies and gentlemen, all protocols. My name is Mark Mulaza Kaira, also known as Makitu, and I'm here with my colleagues Rich Busy, Chester, Gaddafi, and a lot more.
Can they come in front, please?
The other gentlemen are outside.
Proceed.
We represent a company called Kalandanya Music Promotion. I think as artists, we've also recognized that this is not just a fight for the corporate world or the government. It's a fight for all of us, and all of us have to make sacrifices. Already, our events and shows have been cancelled, but we understand it's a sacrifice that all of us have to make. So, as Kalandanya Music Promotions, we're making a donation of 70 boxes of hand sanitizers worth 50,000 kwacha.
I thought you'd also give us a small dance.
Outside. Thank you very much.
thank you so much. Those were the musicians. And Honorable Minister, just to announce that ABSA Bank Zambia Limited has donated to the ministry to help in this fight 20 oximeters. 20 oximeters to be used in our various critical care units across our nation. That was the list, Honorable Minister, and I will call upon you to please conclude our
Distinguished ladies and gentlemen, let us heed the call from His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwa, as he guided the nation in his address to the nation yesterday, to ensure that we avoid economic havoc by preventing the entrenchment of this human-to-human transmission of COVID-19. Let us ensure we stay at home, keep away from hotspots. Let us ensure we wash our hands. Let us ensure we wear our masks, social distancing. Let us avoid public gatherings, and let us ensure environmental hygiene. I want to place on record government's gratitude to the Church, the Seventh-day Adventists of Zambia, Southern region, President Akomba, and the Church. We thank you sincerely for holding hands with government in the fight against COVID. This is as it should be. At a time when we face such a great threat, the Church coming up to work with government shows the solidarity and commitment that the Church has towards the health of the people of Zambia. So we thank you most sincerely. We want to thank the Environmental Institute of Zambia, Environmental
and Public Health Union Zambia.
Environmental and Public Health Union of Zambia. We want to thank you sincerely. As you know, the President did commandeer recruitment of health workers, and I can tell you that we are recruiting more than 600 public health professionals, environmental public health professionals, because we recognize the importance of your staff in port health services, in surveillance, in quarantine, and in contact tracing. You are indeed a visitor group, and you coming on board at this hour shows that you go beyond the normal call of duty to work with government to ensure public health security. Thank you sincerely. Amazon, as you've been working with all stakeholders to ensure shipping of logistics to Zambia, we thank you for your corporate social responsibility program, where now you have worked with us to donate masks that will protect health workers from getting COVID-19 and indeed any other infections. We thank you most sincerely. For our musicians, see why I shouldn't talk about musicians, huh? For our musicians, you know, the top stars in the country, Maktu, Busy, Richie Busy, and your friends from Kalandania Music Promotions. We want to thank Kalandania Music Promotions and you, the superstars, for partnering with government in fighting COVID-19. We urge all corporate stakeholders to emulate Kalandania Music Promotions in working with government to ensure that together we combat COVID-19. We are only productive when we are healthy. So let us work together and support President Lungu's agenda for universal health coverage by ensuring health security. I thank you today. We wind up with a recap. Number of cases, 40 cumulatively, 2 deaths, 25 discharges, 13 under our care, 2 on the Copper Belt, 11 in Lusaka, 1 intermittently on oxygen, and we urge all of us to raise the index of suspicion. Whenever you have a flu, whenever you have a headache, a fever, even if you have no epidemiological link, even if you are not in a hospital, please work with our community surveillance teams who are going to extend testing in the community so that we can test more beyond the people that we pick through our contact tracing and through our hospitals. And in our various hospitals, a reminder to all our staff to ensure that to strengthen hospital surveillance, all cases that are coming with upper respiratory tract infections, respiratory disorders, including pneumonia, we ensure that we test for COVID. This way we'll be able to detect early the case, isolate them, and make sure that we disrupt human